Hi, my name is Dr. Sasha Nunez. I'm a physical therapist with Restore Physical Therapy, Pilates, and Fitness. My videos are meant primarily to be educational for my patients. If you're coming to me from somewhere else, go ahead and read the disclaimer down below. We'll cover anything from physical therapy diagnoses to Pilates, fitness, strength and conditioning. So go ahead and like, comment, and subscribe down below and let me know if there are any topics that you would like for me to cover, and we'll jump into our video. Hi, so if you haven't guessed it already, by Fred here with one arm, we're going to be talking about the shoulder joint. In particular, we're going to be talking about shoulder impingement syndromes. So when my patients come into me with this diagnosis of shoulder impingement, to me, it's primarily a very broad diagnosis. So shoulder impingement really encompasses many different types of impingements, and it's really up to the clinician to figure out where that impingement is coming from. So let's talk a little bit about shoulder impingement syndromes in general. So usually in people that tend to have shoulder pain or symptoms, about 44 to 60% of those people have some type of shoulder impingement. So let's take that in for a second, because that's a lot of people. So when we're talking about shoulder impingement syndromes, it's encompassing many different types of impingements, and there are many different causes to why these impingements are occurring. So let's talk about the shoulder joint itself. So just so that we're all aware, the shoulder joint is comprised of the shoulder blade, the scapula, the clavicle, and the humerus, or the long bone of the arm. So when this long bone, the humerus, articulates with this glenoid fossa, or this surface right here, that is your shoulder joint. So there are many different ways that people can get impingement syndromes. One of the primary things that I will see will cause these impingement syndromes usually is some version of a weakness or a muscular imbalance. So one of the most common types of impingements I'll see is a subacromial impingement. So essentially, there is a bony prominence here called your acromion, which sticks out from that shoulder blade. Anything that gets trapped underneath that acromion, hence subacromial impingement, can get irritated and inflamed. And usually that's the bursa. There's a little fluid-filled sac that lives underneath there that's usually meant to be a protective structure for your tendons and the rotator cuff. But also the rotator cuff tendons lie within that space. In particular, the supraspinatus tendon. So that supraspinatus comes right through that supraspinous fossa, right through, and attaches to that greater tuberosity, kind of that widest or biggest bony prominence on that humerus. Well, that supraspinatus tendon can also get pinched within that subacromial joint. Another type of impingement we'll see is kind of more of this internal impingement, where typically I'll see that in my throwing athletes. So kind of this force, extension, external rotation, abduction motion before they go to throw can irritate and pinch kind of this greater tuberosity against the very posterior or the back part of that glenoid fossa. Another form of impingement that we'll see is coming from the subscapularis. The subscapularis very rarely gets pinched, but it can happen. The subscapularis is a rotator cuff muscle. It comes from the very front of that shoulder blade and attaches to kind of this lesser tuberosity right here. Usually it'll get pinched kind of underneath this coracoid process. It's another bony prominence that comes out and extends from the very front of that shoulder blade. So in motions where the arm is coming up and in, that subscapularis tendon can get irritated underneath that subcoracoid process. And then the last form of impingement I'll typically see usually involves the biceps tendon and the rest of the rotator cuff, but usually those muscles will get irritated along the coracoacromial arch. So that encompasses that acromion that we talked about earlier, the coracoacromial ligament, and the coracoid process. So that biceps long head tendon, which usually runs through that bicipital groove, attaches to the glenoid and the superior labrum, that can get pinched and irritated along that coracoacromial arch, as well as the rest of the rotator cuff tendons. So let's talk about that primary kind of muscular imbalance that typically will cause these type of shoulder impingements. So when we think about the shoulder blade, there are many different type of muscles that attach to it. So we have kind of this diamond shaped trapezius muscle. We have these upper fibers here, middle fibers here, and the lower fibers here. Well, when the lower trapezius is functioning well and it's contracting well, what will happen is the shoulder blade will rotate kind of up and outward in this motion, and that assists with kind of this elevation of the shoulder joint. In a dysfunctional kind of movement pattern, we'll see weakness in that lower trapezius muscle, and sometimes I'll see compensatory strategies start to kick in. So we'll see kind of that upper trapezius begin to kick in a little bit, and really that's a very faulty movement pattern. That upper trapezius really accounts for maybe about 3 degrees of shoulder kind of upward rotation or scapular upward rotation. So if you're trying to lift that arm with that muscle, you're not going to get very far. So you really want that lower trapezius kicking in to help you with that shoulder elevation. We also see compensatory strategies from levator scapulae. So oftentimes we'll see neck pain and cervical spine pain accompanying our shoulder pain. And oftentimes that's because that levator scapulae muscle, which begins here on that superior border of the scapula and attaches way up high on the cervical spine, will begin to kind of recruit and contract to help us with shoulder elevation. That muscle necessarily was not necessarily meant to help us with shoulder elevation, so that's another faulty movement pattern. So another muscle we want to think about in terms of the shoulder girdle is actually towards the front, and probably one of the most important ones. So it begins here kind of on the inner portion or the medial border of the scapular shoulder blade, and it kind of fans out over the front of the rib cage. When it contracts, it also helps with that scapular or shoulder elevation, but it also helps with protraction. So it helps us with shoulder elevation, and it's strongest usually in about 120 degrees of shoulder flexion, or recruits the best in that position. The other muscle that will kind of change the mechanics of how our shoulder girdle will work usually is the pectoralis minor. That muscle begins here on this coracoid process and also fans out over the front of the ribs. The problem when this muscle is really tight is that it pulls that coracoid process forward, and then therefore tips that shoulder blade forward. So that becomes an issue in our impingement syndromes. When that shoulder blade begins to tip forward, it decreases kind of the space that we have to move that shoulder all the way up. Sometimes we'll also see structural dysfunctions in the acromion itself, and that kind of bony prominence that sticks out from that shoulder blade. And some people that acromion is very flat, and some people it's curved and hooked. Now the problem with that is a very hooked acromion again decreases space in order for our shoulder joint to kind of move as well too. So some doctors will perform what's called an acromioplasty, and they'll just kind of shave off a portion of that hooked acromion or create a little bit more space in that subacromial joint to help us with that shoulder elevation and decrease impingement. So one of the most faulty movement patterns I'll see is that scapula just is not moving, rotating up and gliding down your back the way that we need it to. Another cause for this could be thoracic kyphosis. So thoracic kyphosis essentially is a change and a deviation in the normal kind of curvature of the spine. So we do have kind of this increase kind of curvature in the thoracic spine or the upper part of the back, but in some people it's excessive. So we do have an increased curvature of the spine, and therefore the scapula tips forward a little bit more. So again, that scapula tips forward, it creates less space and less ability for us to move that arm overhead. So go ahead and try this for me. Go ahead and give yourself terrible posture and kind of give me that kind of pseudo thoracic kyphosis, and try to lift with your non-affected arm, your arm all the way up, and see how high can you get. Now straighten your spine up and try that again. You probably got much higher that second time. So that's because that scapula is not tipping forward. So that's the ideal position. We want that shoulder blade to kind of pull down your back. Make sure that lower trapezius muscle is kicking in to help us with elevation of the arm. That will also help that serratus anterior be in kind of the best relationship to be able to contract and recruit as well. So let me walk you through a couple of things that you can do kind of when your shoulder is very, very acute. In the beginning, you may not want to move much because it might be very painful, but there may be a couple of things that you can do just to kind of start getting your posture right on track and making sure that your scapula is moving well. So I would recommend in the very beginning, when it's very, very acute, just try to get that scapula moving in the right position. So shoulder elevation, reaching overhead is not going to feel good in the beginning. You might want to avoid that entirely. But you can go ahead and start moving that scapula in kind of nice, gentle ways. So one of the ways you can do that is just going ahead and rolling the head forward, rounding through the back, letting the thumbs kind of roll in, and letting your shoulder blades kind of protract and kind of glide around the rib cage. And then you're going to pull those shoulder blades back, roll up through your spine, rotate the thumbs out and back, and bring your chest up towards the ceiling. Okay? In the beginning, you may not like a lot of external rotation, so pulling the thumbs out to the side. You may just want to stay neutral, and that's okay. So rolling forward to the crown of your head, rolling those thumbs in, letting the shoulder blades protract, and then pulling those shoulder blades down your back, turning the thumbs out, bringing your chest up towards the ceiling. And we'll try that one more time. So you can do this multiple times throughout the day. Just getting everything to kind of move and getting your thoracic spine to move better, extend better, will help those scapulas kind of sit in an optimal position on your back. When you begin to have a little less pain, you can probably start moving away from this neutral position and starting a little bit of external rotation with the elbows in and your fingertips out. That will help that lower trapezius recruit even better. So the movement can be the same. You're rolling forward, but when you come back, kind of pin your elbows in and pull your fingertips out to the side. Squeeze your shoulder blades together and bring your chest up towards the ceiling. And then try that again, rolling forward, pulling those shoulder blades down your back, spiraling the fingertips out, elbows in, chest up towards the ceiling. So again, you can do that multiple times throughout the day. I recommend repetitions about 20 to 25 at a time. Okay, another thing you can do in that very acute phase is to make sure that you're maintaining your range of motion. So I would go ahead and invest in a shoulder pulley. So I don't have one right now with me, but you can MacGyver one. So I have a rope here and I made a loop on the end. I'm going to go ahead and tie that to a little pole I have here, but you'll go ahead and you'll use your shoulder pulley over a door frame or over the door. And I recommend sitting in a chair with your back up against the back of the chair and or your back up against the wall. Okay, so with your affected arm, you're going to have that affected arm in the loop, and you'll go ahead and use your non-affected arm to bring that arm all the way up as far as you can go without pain. So the name of the game is really protecting that shoulder joint and making sure that you're not increasing any pain or exacerbating your symptoms. So in time, you should be able to go a little bit higher, making sure you're working on sitting up nice and tall, because remember, we're trying to get those shoulder blades to kind of sit in the right position. If you find that you're compensating with your upper trapezius muscles, maybe start a little bit lower and stay in that lower range of motion. So I would start here in flexion about repetitions 20 to 25. You can go into scaption, which is kind of this 45-degree angle, slow and controlled. or you can take it straight out into abduction. I will say that this position tends to be a little bit more painful when you're very acute or in the early phases. So go ahead and limit the range of motion on this one, or stay in the first two positions first. When you start to get better, you should be able to go as far up as you can go, and hopefully through full range of motion without compensating through the upper trapezius muscles. Okay? So in the very beginning, you may not want to move much, so that would be the time to see your doctor or your physical therapist or another healthcare clinician. Okay. So one more way you can help yourself start to get a little bit of movement without having too much pain is to go ahead and get yourself a little ball. Go ahead and deflate it a little bit. You can go to your local supermarket, Walmart, anywhere that sells like these little balls. Even the dollar store, I'm sure, might have some. But come up against a wall, and you can start with your elbow bent and maybe very low in the beginning, and you can start making little circles clockwise and counterclockwise. Again, about repetitions about 20 to 25, just nice and gentle. If you push against that ball gently, you should be able to activate that serratus anterior muscle that we were talking about earlier. Always making sure to stand up nice and straight. Make sure you're not flaring through the ribs. You want to keep the ribs kind of down and connected as you do that. You can start bringing your arms straight if you're feeling a little bit better, and then eventually taking it to about that 120 degrees to kind of get that better serratus anterior activation. So this is a good way to stabilize that shoulder blade and your scapula, just to make sure you can get better elevation over time. Okay? So another way we can get that serratus anterior to activate is to go ahead and use a band and lie down on your back. So I'll do it from here. So I'll wrap it around my shoulder blade. I'll lie down. And you can start with the knees bent to protect your spine in neutral. And then the arms are gonna go up towards the ceiling and about to that 120 degrees or so, keeping the ribs connected. You're gonna punch straight up towards the ceiling, and then squeeze the shoulder blades down and back. And you'll start again, punching straight up towards the ceiling, and then squeezing the shoulder blades down and back. You may want to start with about repetitions 10 to 15 in the beginning, just until you kind of coordinate the movement really well. And then you can increase the tension over time. Okay? So once you start feeling better, you can start trying to recruit kind of that middle trapezius and that lower trapezius muscle group. So you'll do that best lying down on your belly if you can tolerate it. I'm going to go ahead and place one hand underneath my forehead. I can also make a fist and support my head that way. But to activate a little bit of that middle trapezius and lower trapezius at the same time, very gently, you can start with kind of pulling that shoulder blade up and back. Think about bringing that kind of lowest point of that shoulder blade kind of down towards your back pocket, and think about bringing it towards your opposite kind of butt pocket and coming right back down. Think about pulling that shoulder away from the mat. So sometimes I'll see people compensate and try to extend, but they rotate forward. That creates kind of bad patterning because it increases kind of the instability in the front of the shoulder, and that glenohumeral instability will just become more problematic over time. So just make sure you're limiting the range of motion if you have to compensate. You're really focusing on pulling the shoulder blade kind of towards midline, in towards your spine. So making sure that shoulder pulls away from the mat. Okay? You can also go out to the side. That will recruit that middle trapezius a little bit more. Thumb up and coming back down. In the beginning, the shoulder external rotation may not feel as good. You can try palm down, but thumb up is preferred. So the movement pattern is very similar. You're trying to squeeze that shoulder blade towards midline. And then the last one, which is probably the better way to recruit that lower trapezius, will be with the thumb up, coming kind of at this angle. So with that one, you're still thinking about kind of drawing that shoulder blade up and back, making sure that you're not recruiting your upper trapezius, right? So that you're trying to keep the space between your earlobe and the top of your shoulder at all times, and making your way back down. Again, I would aim for about maybe repetitions of about 8 to 10 in the beginning if it feels really difficult, and then over time you can begin adding weight. Okay, so in the very, very beginning, if you can tolerate it, I would recommend repetitions of about 25. So really working on kind of endurance as you go through each motion. So 25, as long as it's pain-free. And then start working on strength. You start adding a little bit of weight and start working towards repetitions of 8 to 10. Or if you need to do about 15 with very low weight, you can try that as well. Okay? When you've gotten much, much stronger, you can start loading the shoulder a little bit more. So usually I recommend some version of a serratus exercise, which will help stabilize that shoulder blade. You can start on hands and knees, dropping the chest down towards the ground, squeezing the shoulder blades, and pulling those shoulder blades away from you. And pushing out and away. You can make that a little bit harder for yourself by tucking the toes under, lifting the knees off, and working from there as well too. And then another way you can try that is full plank position and doing the same thing. So many different ways to stabilize that scapula and use that serratus anterior muscle. As time goes along and you get stronger, you can go ahead and load the shoulder a little bit more and go ahead and make the exercises more difficult, add more load to it, okay? A couple more things in order to get that serratus anterior to activate. One of the best exercises is actually what we call kind of this bear hug position. So I'll go ahead and grab a resistance band, and really it won't take much, but I'll go ahead and use this guy, and I'll use my ladder barrel for right now. You can use kind of your door for this as well too, but we're going to imagine that we're going to hug kind of this tree trunk or a nice big ball. So go ahead and keep kind of the straps above the elbows. You're going to bring the arms out and forward, and imagine you're hugging a nice big ball, or you're creating that first position if you're a dancer. And then you're going to pull the elbows back gently and squeeze them towards midline. Do not flare the ribs. You're trying to keep the ribs connected down and in. And again, pulling the arms out and around. Imagine the shoulder blades pulling around the rib cage, and then the shoulder blades pull together. So that's your bear hug exercise. Over time, you can add a little bit more weight as you get stronger, a little bit more resistance and load. Okay? So the very last one should help you maintain kind of good scapulo-thoracic rhythm and good stability through that shoulder joint. Go ahead and use a looped band. I went ahead and I looped a long band, but you can have just regular loop bands. And grab a foam roller. So to make it easy for yourself, you can just go ahead and put your elbows on the foam roller without the resistance band and roll up and down the wall gently, just going as far as you can without pain. So no pain, no gain is not a thing. You really want to protect your shoulder joint, coming straight up and lowering back down. So this will kind of activate that lower trapezius and the serratus anterior, but primarily serratus anterior. So this is a great one. So you'll use the loop
around the elbows, and you'll do the same thing. So this way you kind of get a little bit more of the rotator cuff to kick in at the same time. So coming up the wall gently and then making your way back down, focusing on keeping the ribs down and connected without flaring the ribs, right? So you're keeping the ribs connected as you go up and coming back down. Okay? So again, if you're in your very acute phase of this injury, go ahead and see your physical therapist or your doctor so that they can help you figure out where that impingement is really stemming from, because there are many types of impingements. You also want to figure out, what are your primary impairments, and usually it stems from some type of weakness or muscular imbalance. So hopefully these exercises will kind of get you started, but it's always best to be evaluated by someone. And if you have any questions or comments, go ahead and put them down below, and hopefully this was helpful for you, and I'll see you on the next video.